Although the outbreak has cut a swath through the region, killing more than 1,500 people, some communities are still disputing the existence of the killer virus. In Liberia, for instance, there are those who believe Ebola is a government invention to source for funds. But a leading social anthropologist who spent a month among communities in the epicenter claims there's more than meets the eye in Ebola denial.
Quand les populations vous disent que Ebola n'existe pas,
when people say Ebola doesn't exist, it's necessary to at least ask the question and to know, is it true or false? What makes them say that? When you're wondering what makes them say that, you realize that people are criticizing something. They're rebelling against something. They're in situations where they are not consulted and they do not feel like they're treated with a lot of paternalism.
Ou elles ont l'impression qu'on les traite avec beaucoup de paternalisme.
Denial has been one of the biggest obstacles in containing the virus. Doctors and nurses have to overcome deep mistrust in communities. 2 weeks ago, 17 Ebola patients in the Liberian capital Monrovia fled from a quarantine center after it was attacked by youths shouting, "There is no Ebola." Nang says some of the communities are unhappy with the prevention measures and medical procedures imposed on them. He is calling for a change in tactic and the inclusion of more women in the fight against the epidemic.
You can't resolve this issue if you exclude women. Now, in the organization of the response, most of the time, it's the men who occupy most of the leadership. We need women in leadership.
Il faut un leadership féminin.
The anthropologist says it will be of immense help if there is greater political will of West African states and collective resources mobilization to send teams to provide clinical and sociological answers. Susan Mongeli, CCTV.